Well, our organization, the Menopause Foundation of Canada, believes that menopause is a significant issue that needs to be understood. If you just think about the number of women in our country over the age of 40, that's 10 million women. We represent 1/4 of the population, and we represent 1/4 of the workforce. And we're actually a very fast growing segment of the workforce. People think that menopause is something you reach, like a destination, an event, and then it's over. And that's a big myth. The reality is that women will spend up to half of their life in the menopause continuum. So average age to reach menopause in Canada is 51, menopause being just 12 months of being period free. But you're in perimenopause for 2 to 10 years prior to that, and in postmenopause for the rest of your life. Women generally enter menopause between the ages of 45 and 55. 1 in 100 women will reach menopause by the age of 40, 1 in 1,000 by the age of 30. So this is a very significant topic because there are more than 30 symptoms that a woman can experience. And as you reach menopause and are in postmenopause, you're at increased risk for heart disease, osteoporosis, and the genitourinary syndrome of menopause, which is something that doesn't get discussed and is very important. And for all of these things, it feels like it's such a taboo topic, and it's so shrouded in secrecy and stigma that it's a mystery that every woman is left to unravel on her own. And that's having a detrimental negative impact, not just on women's health, but on our families, our communities, on society, and certainly in the workplace. And it needs to be recognized.
Women health issues in the workplace is this large, all-encompassing issue, or not issue, but it's a large, all-encompassing category. I don't think that I can say that there's one specific health-related issue. There's always stuff with mental health, whether it's anxiety, depression. There's so many different factors, and I think women have unique differences, but they also have very similar challenges as well with any other gender, because there are a lot of things that are happening across the board. And I think it's important that we focus on how we can help people on an individual level instead of trying to look at it, from a broader, from a blanket statement or broader policies, and see how we can help individuals through their own journeys within the workplace.
One of the underlying factors that deserves another mention here is the lack of female-based research, which I think is really what delays or causes inadequate treatment for women. So, there's many chronic diseases where women are likely to experience what are labeled as atypical symptoms. They aren't normal because the standard is based on male-dominated research. So, for example, irritability, overeating, oversleeping, those are some of the more common symptoms of depression in females, but they don't always present in males. So as a result, females are diagnosed with chronic disease on average 2 years later than males. It's for the same reason that 50% of women who experience heart attacks have their symptoms go unrecognized. And women are also less likely to receive timely treatments and effective medications. So females experience 75% of the adverse drug reactions in Canada. And again, I believe we can largely attribute that to underrepresentation in clinical trials.